Welcome back. I'm Gail Trauco, and this is Healthcare 911, where we talk all things health. Today, we're again talking to Dr. Christine Ren-Fielding and Dr. George Fielding from NYU. And today, I want to talk about how patients know what the right bariatric procedure is for them. Where do they get their information from, and who helps them make that decision?
Right now, the major source of information for individuals about surgery is the internet. There's a lot of different operations, different options out there, and once an individual decides that they will embrace accepting help from the medical profession, then they'll go onto the internet. After that, I think their physician will help them decide which surgeon to go to, which physician to go to, and then the decision is between the surgeon and the patient to discuss what are the options, what are the pros and cons of each operation, should the patient undergo surgery or not, and which one to choose.
What is a gastric sleeve? That's like the hot topic on the internet, and when I'm talking with personal patients that I have in my clinic, they're all, I want a gastric sleeve. What is the gastric sleeve?
So a gastric sleeve is definitely the hot topic at the moment, as you said. It's not a sleeve, you're not wrapping something around the stomach. You're actually cutting out 3/4 of the stomach.
So it is a resection.
It's a resection of the stomach, and it's a very effective operation. And because what it does is it reduces the volume of your stomach, and you have a cut edge to the stomach. And if you remember when you're a kid and you fall over and you scab your knee and you get a big thick scar, well, that happens down the side of the stomach, and it makes the stomach rigid, so that when the food comes in, it can't stretch. And it goes along with this feeling of not being hungry. And so it's very popular. It's an immediate, you get an immediate response because your stomach is a fraction of size of what it was, and it doesn't stretch anymore, particularly in the first 6 months or so after the operation.
How quick does a patient see weight loss with a gastric sleeve?
Boom.
And in the first 12 months, if a patient has 100 pounds to lose of their body weight, would they lose that all in 12 months?
They would lose a lot of it.
What's a gastric bypass? You just said you were resecting the stomach for a gastric sleeve. What's the difference with the sleeve and the bypass?
So as George said, the sleeve, you're physically removing 80% of the stomach. But in the gastric bypass, you're not removing anything, but rather the top of the stomach is sliced and separated, and then a piece of intestine is brought up to reconnect from the top of the stomach to the intestine. So it's really a rerouting. It's reduction of the size of the stomach, but a rerouting of food away from the original stomach, but nothing's being removed.
What is gastric banding? I know one term that I've heard often is lap band. So what is a gastric band?
So the lap band is a device. It's been around now for well over 20 years. And it's been used safely in hundreds and hundreds of thousands of people. And the thing about the band is you don't cut anything. You're just wrapping this little ring with an internal balloon around the top of the stomach. And I mentioned before with the sleeve how they get a lot less hungry. That's how the band works as well. It wraps around there and you gradually tighten it over time. And that compression at the top of the stomach, by physiologic means, reduces hunger and the urge to eat. And to me, it's got a big role to play because you're not cutting anything.
What is a BPD-LS?
So a BPD-DS is a biliopancreatic diversion with duodenal switch.
I can't spell it, Christine.
It's a mouthful. But in lay terms, it's removing part of the stomach and then rerouting the intestines so the distance between your stomach and your bum are shorter. And what that means is that you're not absorbing most of the fat or the protein and also some nutrients that you're eating.
Of all the procedures we've discussed, what are the pros and cons very quickly of each? Where I'm a lap band patient and I've lost over 200 pounds.
Congratulations.
And I've kept it off.
I'm one too.
But I watch what I eat continuously. Every day I monitor what I eat. So of the other procedures, what are your patients choosing today?
There's no doubt at the moment you'd have to be blind, deaf and dumb not to know that the sleeve is top of the pops. But the issue with, you mentioned what are the pros and cons. The pro is it works, boom, and that's what everyone talks about. That's what the internet is all agog with. At the end of the day though, a significant percentage of these people sadly regain their weight. And that's because that stiff stomach heals and it gets soft again. And so when the food comes down, it can stretch again. And you and I both know, because we've both been there, that our enemy is hunger. And our enemy is not being full. And the con with the sleeve is that over time, that stuff, that enemy comes back. You get hungry and you're not full and you're on your own again.
Stay tuned to Health 911 where we cover life-changing topics.